there. Thanks for joining me again on today's episode of Self-Manageable Illnesses and Their Treatments. So today I'm talking about cancer. This is an area that it's always difficult to discuss and talk about. But these days we try to talk about prevention rather than cure. I mean, there has been a lot of research. People are working hard every day to find a cure for cancer. I think one of the problems we have is diagnosing it on time, or prevention. I think what I'm going to talk about today is a prevention of cancer, specifically lung cancer. I know in UK there's over 40,000 cases of lung cancer diagnosed every year in UK. That's a lot of number for just one small country. And so lung cancer is an area that I want to talk about today, about prevention. Like I said, this channel is all about prevention and managing it the way we can, as much as we can, to help ourselves. So as your pharmacist, today I'm going to be talking about 8 things you can do to help prevent lung cancer. Some of these things we cannot avoid it, but we can do something to prevent it. So listen on to see the 8 things we can do, or 8 signs to watch out about cancer. Number 1 is when you are coughing. Cough is common when you have hay fever or you're asthmatic or you are allergic. Sometimes coughing is common. But my advice is when that cough lasts more than 3 weeks, it's time to consult your doctor or your pharmacist or your GP, because sometimes these coughs can lead to cancer. I'm not here to scare you, but it's always good to be safe than sorry. So if you've had a cough that has been bothering you for up to 3 weeks, it's time to consult your GP. It could be a medication. I know some new medication. I know medication like what we call lisinopril for blood pressure treatment. It has a side effect of cough. So it could be that the cough is a side effect of a new medication. So when you're having constant cough lasting for up to 3 weeks, beyond 3 weeks, you have tried cough medicine, you have tried everything, and you don't think, and maybe you have also been to the doctor and they're giving you medication for an infection, or maybe you're asthmatic but you feel your asthma is stable, then my advice is, if that cough has persisted for up to 3 weeks or beyond, to consult your doctor or GP. That's number 1. Number 2 is any cough that rather than getting better is getting worse. So if you're getting a cough that rather than it getting better, it is getting worse, my advice is also to consult your medical professional to do some blood tests to ensure that it's not a dangerous cough. Another sign of early onset of lung cancer, or that what could be to prevent lung cancer, is any chest infection that keeps coming back. I know that there are disease conditions like COPD or any pulmonary diseases where people are liable to infection. But it's always good to check. Do not assume that each respiratory infection that comes with cough that is due to COPD. So if you have a cough that keeps coming back, or chest infection that keeps coming back, my advice is to have a consultation with your GP or with your doctor to have a look, to check. Sometimes people say, I've tried, but I couldn't get an appointment. My advice is to keep trying, because sometimes it's your own health. And my advice is always keep pushing until something is done, to have a definitive answer, to make sure that it's not something sinister. So if you keep on having chest infection that keep on reoccurring, my advice is to have a test. Number 4 is that if you're coughing up blood, that's not normal. So if you have this cough that is you're coughing up blood, that's a warning sign. That is something to tell you that something is not right here. I know sometimes there's a rupture of blood vessels, and it could be something that is not serious. But it could be. It's always good to find out. It's always good to confirm. So if you're coughing and you're coughing up blood, please have a quick check with your GP. Number 5 is aches and pains when breathing or coughing. So if you find yourself that when you're coughing, you're aching all over or it's affecting your breathing. Again, people who have COPD or asthma or emphysema, yes, I know they have breathing issue. But these are the kind of symptoms. Maybe you've had COPD for a while, or you've had asthma for a while, or you have emphysema for a while, and all of a sudden you know your body more than anybody knows. Yes, so if you're having a breathing issue or aches and pains or coughing all coming together and lasting longer than it should, I would say consult your GP. The other point is persistent breathlessness. I know that there are other things that could be causing breathlessness like asthma or COPD, again, or other breathing issues, but it's always good to rule out lung cancer. Yeah, so if you're coughing constantly and you're feeling breathless, sometimes people are coughing and they can't breathe. My advice is to have a consultation to make sure it's not something sinister. The other point I want to make, the second to the last final point, is persistent tiredness or lack of energy. You know you're having a good night's sleep. You know that you're eating well. You know that you haven't done anything that is making you weak or tired or lethargic. You just know that this feeling of tiredness has just come on and it's only getting worse and worse. My advice is to consult your GP, consult your doctor, if you mean going to a specialist, just to ensure that it is not an early warning sign of lung cancer. My final point is loss of appetite or unexplained weight loss. Maybe you're not even trying hard, you're not doing anything to lose weight, but the weight is dropping off. Or maybe your appetite is not what it used to be, and you just can't place your finger on why you've lost your appetite. That's also a sign to, ask yourself what's going on here. Make inquiries, go and see your doctor or your GP, try and sort things out, make sure it's not something more sinister. Okay, so those are the 8 points I wanted to make sure about lung cancer, because cancer is one of those things until people are working hard, scientists are working hard with treatment and also looking for a cure. But one thing we can do is to think of what can we do to prevent it or to halt it in its track or to detect it early. And I believe these points will help for an early detection of lung cancer and probably, hopefully, a better treatment and a better future. Thank you for watching again. I hope you have picked up 1 or 2 things today. Give us, give us a comment or a like, and also get somebody to watch this channel. There are so many topics that are coming up, and I'm sure there's one that somebody can pick up to help them to manage themselves and manage their minor ailment so that things don't get worse. Thank you and goodbye.